So I'm Dr. Melanie Palm, and I am here from Art of Skin MD, which is in Solana Beach, California, which is in North County, San Diego. And this is part 2 of lip filling. We have the wonderful Jet Reese from Jet Reese Salon. She is the fabulous and wonderful colorist, and she's our model today. And in part 1, we actually filled this upper part of her white lip using something called the cannula technique, which is a blunt-shaped tube. So we didn't cause any trauma, no bruising. She's had a block, she didn't feel it at all. And now we're going to move on to the pink part of the lip and just enhance some of the natural beauty that she has there. So with that, we're going to pan to Jet. And we're going to start doing a little bit of filling in the upper part of the lip, okay? Oh, sure. So she's got a little bit of a block, so it's a little harder for Jet to talk right now. But what we'll do is we're going to start out, there's some sort of fail-safe steps that I think you can do for lip augmentation. So I typically will start by outlining the border. We get something called a white roll in youth, and that has it's a light reflection that disappears over time. So I want to enhance that, and also by giving some structure to that lip border, you won't get that bleeding when you put on your lipstick over time. It really does help with some of the lipstick lines. I think it's really important to actually put a little bit in this little V shape that we call the Cupid's bow. It really perks that up, and as well I like to put a little bit of structural support in these areas that are called the philtral columns. After that, we'll put just a little bit, I like to put little aliquots or little baby beads of some of the fillers into a couple different areas. I think on Jet, we'll put just a little bit in this pillow here, a little bit on her left, and a little bit in the center, because you can see she naturally has a little bit of fullness there. So those are the 3 pillows that we typically see in the upper lip. On the lower lip, again, we'll do a little bit of bordering. We'll put a little bit in the 2 pillows that she has on the lower lip, and then we'll finish off by putting a little bit in the corner of the mouth. So with that, we're going to get started, okay?
Fantastic.
Okay, so we're going to stretch the lip, and I'm going to do a little poke, but I don't think you should feel anything, Jeff.
No, I don't.
Good. So we're just putting a very fine amount in that lip border. Perfect. And then a little bit back behind. Still doing well?
Oh, yes.
And that's it for that side. I'm going to go from the middle and get this side of the Cupid's bow. And that's pretty comfortable for you. This is traditionally a very sensitive area. You know, the fillers now, and this is Restylane, typically have some numbing in it, but I do find that it's not quite enough to make patients happy. So I, as a point, usually will do a block. I like people to be comfortable and want them to have a good experience with lip filling, and it not to be something that they regale to other patients or friends that it was a less than desirable experience.
I don't feel a thing.
Good. And then you turn just a little bit towards me. That's perfect. A little bit in that center to get that other side of the Cupid's bow. And you can see already that's really brought about that border of her lip. That's just gorgeous. And so last thing we're going to do is help that strut. We're going to help with those, what we call the philtral columns, those little columns that come from the nose down to the lip. All right, Jet, you shouldn't feel this as well.
I don't feel it.
Awesome. So now we're actually going to move on to the pink part of the lip, since we've already completed the border. So will you part your lips just a little bit for me?
Yes.
And typically what I'll do is I'll augment the center. So we'll do a little bit of that, a little poke. Do you feel any of that, Jen?
No.
Perfect. And we're going to put just a little bit this side here. I'm going to come over to the other side. We'll do you right.
It's so much more comfortable than in the past.
Good. And then a little bit on this side. 1, 2, 3. Awesome. So I'm very happy with that. Again, we want the lower lip to be a little fuller than the upper, so I think that's perfect just right where we are now. Before I actually do the lower lip, I'm going to put a little bit in the corner of Jet's mouth to kind of perk up the corners of the mouth and turn the frown upside down. How does
Oh,
that
sounds great.
A little poke. How was that for you?
Oh, I didn't feel it.
And that helps just give a little structural support to that area. And it's really a pretty comfortable area to fill.
Mm-hmm.
We'll come over to your other side and we'll do that one. So a little poke on 3, okay, Jen?
Oh, yeah.
1, 2, 3. And I know I may be blocking the screen, but it's always really important to have your physician have a really good firm handle on where the skin is. All right, and then let's start filling the lower lip. So, Jack, I'm going to do a little poke and we're going to start doing a little bit of
Okay.
the, and we're just doing a little bit to accent that border. I'm going to do a second one back here. And the whole idea with lip filling, I think lips that look good, the majority of our volume in our lips hangs out in the middle third to middle half. So when people get too much volume out here, that's when they start to get that ducky look, which is what we're trying to avoid. I'm going to do a little bit of filling on this side. 1, 2, 3. Awesome, Jet. And turn away from me just a little
Okay.
bit. Okay. And then the last little bit that we're going to do on Jet is the actual pillows. So she's got a pillow here and a pillow here, and that's what we want to accent. So oftentimes this is, if the patient wasn't blocked, this is more comfortable. I'll actually go through the skin to get up to this sort of volume building area of the pillow. It's also less traumatic. There's less opportunity for a bruise. I find with most of my lip patients, I really don't cause a significant bruise. And I think with careful placement and going slow, you can have a really nice effect. So a little poke on 3, Jet. 1, 2, 3. Did you feel that at all?
Oh, no. Mm-mm.
And I just kind of rotate and I'm putting small little amounts or aliquots. And I'm really careful to look and see how much volume I'm putting on sides. Not everybody is symmetric. Jet has very pretty symmetric lips. So I was able to put just about a tenth and a half on that side. Just a tiny bit more, okay?
Mm-hmm.
And then we're going to come over to our other side and finish up and we'll be all done.
Oh, great.
Okay, so just like on the other side, we're going to do a little poke here. 1, 2, 3. And again, I'm sort of moving side to side, putting little amounts so it looks really pretty and natural. And that's it.
Fantastic.
So Jet will be numb probably for another hour and a half because of the block. Her smile is actually pretty symmetric for having a block in right now. Sometimes it'll be a little funny because of the block, but you can see just really pretty natural enhancement. After we do the filling, I always tell patients that after we do Juvederm or Restylane, they're very water-loving molecules, and so for about 1 to 4 days you can have a little bit of swelling, but the lips look really pretty and usually last you a good 6 to 12 months, sometimes a little longer.
Oh, fantastic.
Thank you
Thank you
for
so
being a
much.
part